California doctor and businessman making headlines over $1 billion effort to fight cancer. It includes the use of DNA sequencers to better understand how to treat the disease. But critics now questioning some of the doctor's claims, saying some of his ideas are really not all that radical or original at all, including this comment in a 60 Minutes interview last night.
A cancer is not what people think, cells growing. Actually, a cancer is actually the inability of the cells to die.
Dr. Campbell is a practicing cardiologist and assistant professor of medicine at the University of North Carolina. Doctor, always good to see you.
Good to see you, Shannon.
All right, can you explain a little bit about what DNA sequencing is, how it helps us to sort of understand or unlock some of the mysteries about cancer?
So genetic testing or genomics is really the future of medicine. I think we're going to see a day one day where we all walk around knowing what our genetic sequence is. The importance in cancer is if we can figure out what the genetic markers are on particular tumors, then we can target therapy particularly just for that type of tumor, and we see better success rates. So it's very promising, but it is not something that's going to happen overnight, as this doctor may have suggested last night.
Yeah, and we've got a soundbite from another doctor who is kind of hedging that and saying a little bit about the fact that this maybe we're not there just yet. Here's what he had to say about the plans for this research.
To say I can throw a tumor into a gizmo and that gizmo will tell me the answer in a few minutes and everything will flow from that. I don't think we're there now. I don't think we'll be there next year. I think there's just too much hard, complex science that has to be done before this is state of the art. But it's a very cool idea for the future.
But doctor, would you have any estimated timeline or what we're talking about? Is this something that's in the realm of 5 years, or are we talking more like 50 years before we get to what these theories are based upon?
You know, we're already making progress in this area, and I think that we're looking at 5 to 7 years of making even more progress. I don't think we're ever going to see where we just put something into a computer and spit out the answer of the perfect drug. But I do think these types of things can help target our therapy, guide our therapy, and potentially really significantly improve outcomes for cancer patients.
Okay, two other things I want to make sure I hit. First of all, this doctor is under criticism because people say that he's offering up, investment possibilities for people to help fund some of this research. I mean, he is worth more than, by the latest estimate, $13 billion. I mean, can he still be a great scientist in making progress here? Or, as some of his critics are saying, he may be overblowing exactly what he's doing because he does have a financial interest in this?
Well, I think there is some concern of overselling things, but I think what we really ought to focus on is he does have some good ideas, but we need to make sure that we undergo very rigorous clinical trials, do the science as the other physician had mentioned, make sure that we prove these therapies to be safe and effective for patients. I think that, we still have to go through the FDA, and, there may be some room for improvement through the FDA process as well.
Okay, something else that this doctor talked about is it's more about mutation than location. The thought that if you have lung cancer, that's a specific kind of treatment. If breast cancer, it's something different. But it may not actually be about the location of where your particular cancer crops up.
Exactly. What he is suggesting that if you have a particular mutation that causes a cancer in the GI tract that responds like a lung cancer mutation, it may be reasonable to try a lung cancer drug. And we've seen that in some small trials. So I think it's really a combination of efforts using not only genetics, but also some of the other standard chemotherapies that we have used for years, and putting all that together to provide the best treatment for each individual patient. It's called personalized medicine, and that's where we're headed.
Sounds good to me. All right, doctor, always good to see you. Thank you so much.
Good to see you, Shannon. Thanks.